We have an opportunity to save thousands of lives a year with a single intervention, pre-hospital blood. Uniform access to blood can have a major impact on outcomes for our trauma patients. Trauma is the leading cause of death for patients aged 1 to 45, and bleeding to the point of exsanguination is the leading cause of preventable mortality in that population.
I'm going to start off with the bad news. Right? The bad news is that only about 1% of EMS vehicles, whether it's ground or air, carry blood in the United States. Trauma is the leading cause of potentially of death in the United States. Hemorrhage is leading to death, is the leading cause of potentially preventable death. And the best estimate that we have right now is probably 10,000 lives a year could be saved if every ambulance in the United States had blood.
I think there's a couple really big barriers that we're facing right now. In some states, actually, EMS professionals aren't allowed to initiate blood in the field. So we need to fix the scope of practice issues that we see throughout the United States. The other one that's really a profound one is the reimbursement cost. EMS and emergency care provided in the field reimbursement is still really based on transportation only and not necessarily the care that's given. And we really need to switch that paradigm such that we really can get reimbursed for this life-saving issue and keep the EMS agencies, keep the lights on for the EMS agencies. As Dr. Holcomb said, it's only 1% to 2% right now. That's about 175 ground crews over the United States, and a lot of them are doing that at their own cost. It's not cost neutral. They're doing it at their own cost, which is fantastic for them. But, again, as Dr. Pearson will, I'm sure will point out, it's, in the rural communities, 50% of these EMS agencies are volunteer. And the volunteer agencies do not have the resources to be able to flip the bill on this on their own.
The transfusion practices are one of the best examples of the reciprocity between military and civilian trauma systems and how we can learn from each other. We started fielding pre-hospital blood in 2012, getting it out on helicopters, and moved to using whole blood pre-hospital. And the initial study that came out in 2017 demonstrated a 4-fold increase in survival in the first 24 hours. So 4-fold increase in survival. And that survival was also for 30 days. So it increased 30-day mortality as well, or decreased 30-day mortality by 3-fold. So huge life-saving capability.
The disparity here is really what you have to focus on. If you think of all the motor vehicle crashes, 50% of all motor vehicle crashes occur in a rural area, not an urban area. They occur in a rural area. And if you think that only populates, or the only population there is 19% of all of the U.S. lives in a rural area, but the disparity is that 50% of the crashes occur there. When it comes to transfer time, so pre-hospital transfer time or pre-hospital identification time is over double in a rural setting. And most people would argue it's probably tripled or quadruple. So if you got injured here and it took you 10 minutes to get to the hospital, it'll take you an hour. And if we talk about a majority of 30 to 40% of trauma patients are found alive but then die, it's potentially in an MVC, you can really see that potential intervene is immediately important. And I like to think of the rural environment similar to somewhat as the military environment, where it's a more forward station. There's multiple steps to get me to where I need to go. And we have to move that blood to where the people are. The problem is where the people are. It's not at the hospital. So we really need to push that forward to get it where it's needed, and that's in the field.
Number one, go donate blood. Right? Go donate. If you don't donate, you need to donate, because the blood suppliers need more blood to give to EMS agencies so that they can give it to patients. And in the meantime, you should all go home, call your local EMS agency that covers your house, and ask them if they have blood. If they don't, why not? They'll tell you some of the reasons we've talked about, and then talk to your local congressman and senator, right? Because CMS needs more money to put money into the budget so they can pay for it.